Please note that this session is being recorded. If you do not consent to being recorded, you are asked to drop off the session at this time. Thank you. All right. My name is Adriana Marzette, and I am a public health program coordinator here at the National Indian Health Board. Thank you so much for joining us for today's session on responding to infectious disease outbreaks in Indian country, how to engage American Indian and Alaskan Native entities in their outbreak response. I'll share more about why we are here today and what we're trying to achieve. But before I get into that, I want to have just a little icebreaker. I just want to see how y'all folks are doing today, how you going to engage with me today. So right now, I'm going to pull up a poll question, and I just want to know, how are you feeling? And all responses are anonymous. You can be very open and honest and transparent. There's no snitches. So we accept you for who you are here. All right, so for the most part, I like the fact that 70% of us are feeling okay and 23% are alert. Those that are feeling tired and unmotivated, just give me a moment. We'll see if my energy can feed through the screen. And if not, I encourage you to stand. Trust me, during this hour, I will probably stand because it's the afternoon and just like move around. Sometimes that will help. We are at that 3 o'clock, almost to the end of the day, you know, that after lunch feel. So don't be afraid to like move around. And then another little icebreaker. Would you rather travel back to the past or to the future? Ooh, interesting. Okay, I like how everyone was quick with that response. I like the participation for this one. Okay. So it seems here that most people would like to travel back to the past. Okay, that's awesome. Okay, so thank you all so much for participating. I like that. I like that. Trust me, I do. So why are we here today? Simply put, we are here today to have a conversation that explores the relationships and the barriers between non-American Indian and Alaskan Native entities, tribes, and tribal organizations when it comes to addressing infectious disease outbreaks like COVID-19. We have had a lot of questions recently. We had our conference, we've had a lot of listening sessions, and a lot of non-tribal entities have really started to engage with us more about asking us, how do we build that relationship with tribes? How do we start that process? How do we reach out to the epicenters? How do we get access to, to those listservs? So we're here. That's what we're here to talk about. We're here to talk about and explain how tribal governments work and how you as health departments, local agencies, county agencies can reach out to the tribes in your state, in your area, and really build those relationships. So the main objectives of today's session is to explain the concept of tribal sovereignty, identify 2 impacts of tribal sovereignty policies on tribal partnerships and government-to-government relationships. And then we're going to talk about some effective strategies to improve that communication and interactions with tribal leadership, epicenters, and communities during outbreak response. So leading this conversation today are 2 of my colleagues, which I love and I've grown to adore. We have Karrie and Kristen, who will expand knowledge about tribes and improve non-native government employees' familiarity and comfort with working alongside tribes. Please be aware that the beginning of this session will be recorded. All participants have been muted. Please leave yourself on mute unless the presenter specifically asks you to unmute yourself to engage, and you are more than welcome to type questions and comments in the chat box. I will make sure that Kristen and Karrie address them. If not, Courtney and I, if we can address them, we will address them. And again, just the beginning of today's session will be recorded, because when we go out into breakouts, I really want you to feel like you can share with no penalty. And the presenter's PowerPoint presentation will be available to you to download after this webinar. I will email the slides along with the recording and the evaluation to everyone that registered. So just in advance, thank you all for coming today, and let me introduce you to some awesome ladies at the National Indian Health Board. First, we're going to have Karrie come. Karrie is our Deputy Director here at the Public Health Policy Programs Department. She's been with National Indian Health Board since March of 2015, and she brings over 13 years of experience in public health. She received her bachelor's in anthropology and an MPH in health promotion and education, both from the University of South Carolina. Before joining the National Indian Health Board, she had the honor and privilege of working with Native communities in North Dakota and Cherokee, North Carolina with the Eastern Band of Cherokee Indians. Kristen is an enrolled member of the Navajo Nation. She serves as the Tribal Health Outreach and Education Policy Coordinator for the National Indian Health Board. She has been with the organization for over 5 years. Kristen provides phenomenal technical assistance, education, and training on the Affordable Care Act, Medicare, Medicaid, Children's Health Insurance Program, and just general changes in the Indian healthcare system. She's very much a subject matter expert. She serves Indian country as a national advocate on the importance of outreach and education activities at the ground level to drive the Indian health system and connect consumers to better care. And Kristen has extensive experience with the Indian Health Service, tribal and urban programs. So with no further delay, I would now turn it over to Karrie and Kristen. Kristen.
Thank you, Adriana. And thank you for inviting me to be here. So I'm just trying to get set up here. I have one little screen that I'm trying to work with. Just a minute. So first of all, I'm going to go first. I think that's the plan, and then Kristen's going to go second. But as I'm presenting, I'd certainly invite Kristen to join in, as well as Adriana and Courtney with NIHB. For those of you, just a little background on myself, I am non-native. I have been working in Indian country for a while, and much of learning about working in Indian country comes from working in Indian country. As you know, if you've been through school, unless it's a specific native program, how Indian health works isn't taught. It's something, you know, I've had to pick up, and probably many of you, if you don't work for tribal organizations or have not, or just starting, you know, it's something you have to kind of learn. So I'm happy to be presenting this, and hopefully that some of the information I share will stick. I feel like I'm still learning about Indian health, about sovereignty, in concept and definition. It's like, oh yeah, okay, I get it, that makes sense. But when you try to see that in action, it's not as easy. And so I admire tribal leaders who I've witnessed over the past 7 years consistently having to educate people about tribal sovereignty and how Indian health works. And it's a constant challenge. But but it's well worth it to increase that knowledge. So I just wanted to say that before I started. Courtney, I believe you're sharing the PowerPoint, and you can get off. We can go to the next slide. Yes, okay. So I like to start with a myth that I often hear people talk about, and they'll often say, oh, well, Native people or Native Americans get free healthcare. So I'd like to start with that, because it's not necessarily free. Basically, these services have essentially been prepaid. As with most, if not all Indigenous people prior to European contact, Native Americans had complex traditions, cultural practices, complex social organizations, their own forms of government, ways to educate, and spiritual traditions that they're all interrelatedly work together, and that ensured the health and survival of the people. That was public health, kind of, all that working together. This health and balance was intrinsically tied to the land that Native Americans lived on or hunted, fished, gathered, and for some tribes farmed. European contact in North America brought devastation to Indigenous tribes by way of sickness, disease, warfare that really decimated the population and also drove many from their lands. And that was followed by US expansion westward and federal policies that forced relocation, forced people onto reservations, forced assimilation, unfortunately broke the treaties that they had, and so basically sold Indian lands. It's amazing, that tribes were able to survive all that, and to see that the populations are growing and the tribes are getting stronger is great. But just wanted to provide, that context. And so the US government has what is called a federal trust responsibility to provide health service to American Indian Alaska Natives. The federal trust responsibility came about through numerous treaties, Supreme Court cases, legislative acts, and executive orders. Through the trust responsibility, the federal government took on a duty to provide health care and other benefits to tribes across Indian country. While there are agencies set up to fulfill this duty, like the Indian Health Service, to date, the duty has not been fulfilled. IHS was established in 1955, and the responsibility of Indian health was transferred to this agency. We know that IHS is underfunded by about 40 to 50% of the need, and most of the funding goes to health care, not population health. And just so we know that's the focus of public health. All right, next slide. Just to talk about sovereignty a little bit, and sovereignty refers to the inherent right of tribal nations to govern themselves. Tribal sovereignty is recognized and protected by the US Constitution. Again, those legal precedents and treaties that I mentioned in the past slide. And public health, in the context of public health, tribes have inherent authority as sovereign nations to protect and promote the health and welfare of their citizens, and using methods that are most relevant for their communities. I just want to note that tribal citizens are also citizens of the United States, as well as the state in which they live, and are entitled to the same rights. And I don't want to insult anyone's intelligence with some of this information that may be very basic, but I just want to make sure I'm covering the basics. So the tribes have a government-to-government relationship with the United States. That is, their government-to-government relationship is with the United States government, not the state governments, although not many, but some states have built very good government-to-government relationships with the tribes in their states, and it varies quite a bit across the country. I do want to address another myth, again, that we hear often saying, people say that Indian nations, were conquered. So therefore, they should assume the role of a conquered nation and succumb to the conqueror's government. But I'd really like to read a quote from a book called Myths and Realities of Tribal Sovereignty, the Law and Economics of Indian Self-Rule, because I feel like this really addresses this myth quite well. The reality is that few tribes in the United States were conquered in military campaigns. Most, but not all, tribes entered treaties with the United States. This was particularly true of those that engaged in military combat with the United States. The very act of treating is a nation-to-nation form of intergovernmental interaction. This is the current policy of the United States and has been so for 40 years, to recognize tribe sovereignty and to assure its continued existence. This policy is based on promises made by the United States in its 250 treaties with Indian nations and is based on recognition of tribes' sovereignty embedded in the US Constitution. I feel it's just important to kind of address just that myth of this conquered nations, and that's really not the case. One important piece of legislation is the Indian Self-Determination and Education Assistance Act of 1975, or Public Law 93-638, which allows tribes to deliver IHS, Indian Health Service, funded services to their own communities. So it's really only been since 1975 that tribes have had the opportunity to deliver some or all health services to their members rather than the federal government. So I'm going to pause there briefly and invite Kristen if she'd like to add anything about the sovereignty before we go into a breakout discussion on that.
Thank you, Karrie. I think the main thing to understand when you're thinking about interacting with tribal members is understanding the history of who they are, because a lot of how things work in all tribal nations is that it's a community, and they look at how things are running within their community. So they look at each other and they want to make sure that they're protected, and they want to make sure that they get the information that they need. So when you talk about tribal sovereignty, they look at themselves as they are running their own government, that they are running their own programs within their community. And if you disrupt that, then there's something that they will want to know of, what's going on or what's happening. But it's always good to understand what that really means to the tribes and what sovereignty means for them. And sometimes being on the outside of that, you might not get the whole meaning of it. But when you start learning more about it and understanding when a tribe is saying that we're practicing our sovereignty, and especially during COVID, this was a huge thing where a lot of our tribes decided to close some of their access to their tribal communities. And that's how they were practicing their sovereignty, was to make sure that they were protecting their tribal members within that community. Thanks, Karrie.
Yes, thank you. Next slide. So I think we're going to do a breakout. Dree, and I put 10 minutes here, but I think it's going to be 15. Dree, did you want to introduce this breakout, or did you want me to?
You can introduce this one.
Okay, so we're going to break out, it looks like maybe into about three different groups, and would like, once we get in the breakout, for everyone to kind of take a few minutes and think about how would you explain tribal sovereignty to somebody. Say, just let's assume it's your job to educate someone on what tribal sovereignty is. What is your elevator speech with that, or what is, how are you going to do that in a very short amount of time? It's, it could be a coworker or something like that. So when we get into the breakout, we'll maybe take a few minutes, and everyone can have a few minutes to jot down some thoughts, and then we can share how we might do that. And again, no, this is not a test. This is just practice. So I think we're ready for the breakouts. Okay, this next section, and we'll probably tag team this, Kristen, right? Sorry, we're a little confused. Is really just kind of an overview of some of the players in Indian health, because these are all opportunities for partnerships and relationships when it comes to doing any sort of work in partnership with tribes or trying to, advance health for American Indian Alaskan Natives. So next slide. So this slide really just talks about tribal public health systems. Tribal health systems are very complex. Like I said, the Indian Health Service was established in 1955. It is a federal government agency. The Veterans Administration is the only other government agency that provides direct healthcare services to U.S. citizens. It's headquartered in Rockville, Maryland, in the D.C. area. Prior to 1955, it was in the health responsibility was in the Bureau of Indian Affairs. So the Indian Health Service has 3 mechanisms by which to provide comprehensive health services. One is direct services. So there's tribes who have Indian Health Service facilities located, in their communities. The employees are employed by the federal government and they provide the healthcare. And Kristen is probably going to roll her eyes because I'm simplifying this so much. So I'm going to give her a chance to add in. So that's one mechanism, is direct services. The second mechanism is the provision of healthcare services through contracts and compacts with Indian tribes and tribal organizations under the Indian Self-Determination Education Act. As you probably heard me say, Public Law 638. So that term 638 is used quite frequently in Indian country to refer to either tribes that contract with the Indian Health Service or compact with the Indian Health Service. And when they compact, they have really assumed all responsibility for the health services. The funding still, they get funding through this compacting agreement through Indian Health Services, but they are responsible. And then the third is contract and grant funding to urban Indian organizations that are providing services to American Indian Alaska Natives that live in urban areas, basically off of tribal lands. Kristen, that was my really short. Do you want to add anything clarifying to those different mechanisms?
Thank you, Karrie. So the main thing to understand when it comes to understanding the systems is that a lot of our tribal members that go to one of these organizations, and depending on what, for instance, as Karrie had explained all of the IHS and why it's important to understand those as well too, especially if you're working with tribal members and trying to understand why it's difficult for them to maybe get services outside of their IHS. And understanding also the tribal organization, as Karrie had specifically mentioned about the self-governments, where the tribe takes complete control over the facility, and they can make any kind of rules, any kind of policies, and decide who is going to get services at that facility. And that's extremely important to know, because sometimes when we're working with tribal members and we're asking them to go to their tribal facility and maybe they have the services, and not realizing that that tribe may only take some of their tribal members only, and they don't take outside tribal members. So as it says on the slide, complexity. It really means that you have to understand what this means and to be able to help anybody that you're working with. And it's good to ask those questions. And I'm glad that we're having this presentation and being able to share this with you as well too. And this is where a lot of our tribal members, they get frustrated, because if they're working with someone and all of a sudden, they might not understand that the nearest tribal facility that's there, they might not be able to get the services there, but they're being told, well, you have a tribal facility, that's where you can go, but not realizing that they might not be eligible to get seen there as well too. So, if there's anything about the slide that you're starting to think about or trying to figure out, it's good to ask those questions now as well too. Thanks, Karrie. Back to you.
Sure. Does anyone have any questions? You can always chat those in the chat box. And I think Drew will keep an eye on that for us. And we're happy to stop and explain any of that. I'll keep moving until that happens. How about next slide? Okay, so the next slide just shows the map that shows the Indian Health Service areas. There's 12 IHS areas. We know that Health and Human Services has HHS regions. These are not the same. There's overlap. It's not conveniently, it conveniently doesn't match up. It doesn't match up to, other like EPA regions or things like that. So a lot of Indian Health is organized within these areas. So just showing that each IHS area has an area office. And that area office coordinates that federal administration of Indian Health. Even where tribes have compacted, the area office is still the federal arm in that area that coordinates some of those contracts and compacts. Okay, so I'm not going to get too detailed, but just know that if depending on where you're working, if you're working for a county or a state, knowing what the IHS area corresponds with the area you work in is important. Next slide. Oh yes, sorry.
Can I just add to that? The IHS.gov has a link to where, if you're trying to find facilities maybe within a certain state as well around that area, and it will be able to direct them to whether if it's a tribal, urban, or maybe it's just a outpatient clinic that might be near them. And on the west side, you'll see a lot more IHS facilities, the inpatient ones. When you go towards the east side of it, there's not very many IHS facilities in that area, but you will find a lot of the maybe urban facilities that might be something that if you're helping a individual trying to locate a facility as well too, but that is on ihs.gov.
Thanks. Next slide. Okay, so I just listed, so also corresponding sort of to the IHS areas are what is known as, or commonly called, area Indian Health Boards. These are organizations, they're not government, they're not tied to the US government. They're organizations made up of member tribes. So within each area, and they're formed at different times. Like for instance, the USET, United South and Eastern Tribes, relates to the Nashville area. The IHS Nashville area, within that area, there is an Area Indian Health Board. And in 1968, some tribes in Southern and Eastern tribes got together And I think the Eastern Band of Cherokee, the Mississippi Band of Choctaw, the Miccosukee tribe of Florida, and Seminole tribe met together and shared an idea that some form of unity between the tribes would facilitate their dealings with the federal government. So they created United South and Eastern Tribes. So I just wanted to note that the Arrington Health Boards are often unified, not tribes within areas, but it's, again, complicated because in some areas, not every tribe is a member of the Arrington Health Board. Some are not. And there's only, I think, 11 Arrington Health Boards, but there's 12 IHS areas. So tribes in the Tucson area are served by the Intertribal Council of Arizona. So there's some variance. So again, and I hate to use this phrase because it's gotten kind of a bad reputation, but do your research and know where you are, know who the organizations that are acting and on behalf of tribes, or in conjunction with tribes, or in partnership with tribes. So this is from our NHB website, and we have a page of our member. These are all our member organizations. Our board is represented by each of these organizations, and we have links to all their sites. So if you want to find out more, you can click on the links from our website. Okay, next slide. And let's complicate it more. And let's add in the tribal epidemiology centers. So the techs, as they're often called, are usually housed at Arrington Health Boards that align with the IHS areas. They're their own entities. They're often, it depends on the area and how closely the Arrington Health Board may work with the Tribal Epidemiology Center. Some of them are very integrated. Some are a little more separate. It just depends. So again, you kind of need to, just ask questions and learn what the relationships are. And each tech might provide different services. I mean, the epidemiology services are, they have the same big goals. But when it comes down to the day-to-day, there may be some variance. And the techs work in partnership with the local or area tribes, again, to improve the health and well-being of tribal members. So I'm not going to get too detailed into that. Just know that, when it comes to disease surveillance, data, the techs are going to be pretty active in those areas. They may have specific projects with tribes. I think there's some folks from techs on this call, and I am sure they can attest to some of the complexities involved. Okay, next slide. And then the urban Indian health centers. I believe there's about 44 across the country. Again, they're on non-tribal lands. They are also, I think they're all nonprofits. They're funded through grants and contracts from the IHS under the Indian Healthcare Improvement Act. I think their governance is, I think most of them have a board, and I apologize for not being a subject matter expert in urban Indian health centers, but they're not considered tribal entities, although the boards may be composed of tribes in a certain region. So just know that they also serve American Indian Alaska Natives, and may have ties to some tribes, may not. Kristen, do you want to add anything about that?
Urban facilities. So we have a lot of American Indian and Alaska Natives that live in the urban. I know that the numbers have increased more for the urban facilities, and some of the places where a lot of our tribal members go to. And one thing about this, there was a question that came up about purchase referred care. Purchase referred care is not an entitlement program. It's when a tribal member that gets seen at an IHS or a tribal facility, that if they might not have the services at that facility and that tribal member is eligible for purchase referred care, it's a funding that they have where tribal members can get seen outside of the IHS or tribal facility. But it's unfortunate that the urban Indian health centers don't have purchase referred care. So it's always good to understand that as well too, because sometimes tribal members will get told, oh, go to your urban Indian health center, they might be able to refer you out. Well, unless they have some type of health insurance, that's probably the only time they will get referred out. But purchase referred care is only for the tribal facilities and the IHS facilities that have funding. And one other question that had came up too was also about, where does this funding come from? And for purchase referred care, it comes from Congress. Congress is the one that decides how much money will be put into the purchase referred care, and then that's how it gets distributed to all of the IHS facilities.
Great, thanks. Next slide. Okay, and I apologize for the fuzziness of this slide. So again, just kind of talking about the tribal health systems. This is some data from the Public Health and Indian Country Capacity Scan report from 2019. Tribes that responded, we asked, how many governance structures do you have? Governance structures mainly being, who makes the decisions about health in your community. More than half had one governance structure. Okay, that could be maybe it was a health board or a tribal council. In some cases, the tribal chair or maybe a CEO. But if you look at the red and orange and blue, together that's 41% of tribes who responded to this survey had 2, 3, or 4 governance structures. Okay, so that shows more complexity, and there's different layers. So they may answer to a health board as well as the tribal council, and maybe also the tribal chair. So I just wanted to show, that there's a lot of variety and complexity among tribes themselves and how their public health is governed. Next slide. And then also from the same data report, and I just wanted to show, we asked, what services occur in basically your service area. And these are the responses. So I know we talk about infectious disease. So 57% of the tribal respondents report that other communicable infectious disease data collection, epi, or surveillance occurs in their area. So that's just a little over half. So again, knowing like maybe there isn't any infectious disease surveillance occurring in certain areas, certain tribes. So next slide. Oh wait, don't go back. Wait, go back one, sorry. And also significant is this syndromic surveillance. Only 24% reported that even occurring at all in their regions. So we're thinking about infectious disease and prevention, and you don't know what you don't know, right? Another cliche I'll throw out there. So let's go to the next slide. So within that, the 57% that has communicable infectious disease surveillance, this is, we broke it down like who provides those services. And so we're just looking, let's just look at the orange bar. So tribal health organizations, that's THOs, are the main providers of communicable infectious disease data, epi, and surveillance. But then you see state health departments at 53%. So they're providing a lot too. And they may both be providing that, right? There's overlap. So that makes it difficult, not necessarily difficult, but just a little more complicated, little complex. Local health departments also are providing that service as well. This is a broad category, so it may be certain communicable infectious diseases are provided by the tribe and by the state, but I'm pretty sure there's overlap in both of these. Okay. Sorry, I lost my, here we go. I think, okay. So I'm gonna kind of wrap up this section. Next slide, please. All right, so this is a training that National Indian Health Board created a couple of years ago. It's a online self-paced module called Working with Tribal Nations. You can find it from that link below, just our website. It takes about 3 hours to go through. It's become very popular. Some folks are, really not requiring, but highly encouraging. State, local, federal governments. I know CDC has used it a lot. Folks that work with tribes. Next slide. So just to show kind of what's in there, we gave a big overview on some of the stuff today. This goes in more in depth. It's packaged really nicely. It's interactive. So there's 6 objectives. Again, talking about the history, talking about tribal sovereignty, historical impacts on tribal health and wellness, foundational components of federal Indian law and policy, barely touched on those, and determinants of health, and then some best practices of working with tribes. So I would highly encourage folks to access this and go through the training. We've gotten really good feedback, and just would recommend that. Okay, so I'm gonna, let's see if was there any, okay, there's one question: which entity may most often report data on opioid adverse events? Courtney, do you have any insight on that? And I'm assuming which entity would be state, local, tribal, tech? I'm not sure.
I would have to check on that one because I'm not sure off the top of my head. Because I know some states collect that, but in regards to American Indian Alaska Natives, I will double check that one. I don't want to give you the wrong information.
Okay. All right. So that is the portion, kind of the background, the structure, the partners. Hopefully that's helpful with thinking about, when you partner with certain entities, sometimes you may partner with an entity, but you're still not partnering with a tribe, and tribes know, they, I don't want to say they know that, but they know there's a difference if you're partnering with, say, the Area Indian Health Board, as opposed to partnering directly with them. So I think if you know who's kind of out there and who's working in Indian country, who's not just delivering health services, but who's helping with prevention and data and policy and all that. So just kind of knowing, getting situated and being oriented when you're working in Indian country. And again, working with tribes, and in our breakout, someone put it well, there's proper channels to go through. Um, so I'm going to turn it over to Kristen to talk more about maybe some of the proper channels and actually, partnering with tribes themselves and some things that you might want to consider.
So working with any tribal community, it's good to understand what their culture is. And, culture itself is an identity for each one of us, no matter who we are. When it comes to tribes, you think about language, their belief system, their customs, traditions, their religious beliefs. And so, and also knowing the fact that a lot of the tribes look at things within their community. So everything is about who is within their community when it comes to that. When it comes to their health, what are they looking for? They're looking at a medicine man, they're looking for a medicine woman, they're looking for herbs. And so understanding what some of those beliefs are for our tribes is extremely important to get that connection going, to be able to engage with them. If you understand what their beliefs are, your engagement with them is going to be more successful. And understanding a lot of how they do things within their tribal communities as well too. And even just having this discussion and being able to have you here to listen to some of that is extremely important. And to know that, how do we get that engagement going? Why would it be so difficult? And as we talked about tribal sovereignty and why that's important and what you need to know about them, so that you don't go in there, maybe saying, oh, is this a tribal nation, when they refer to themselves as villages. And so those little terminologies of knowing what their tribal communities the means to them, and knowing who they are. And Karrie had sort of touched on a little bit about how some of those myths are, and the taboos about American Indian and Alaska Natives as well too. And knowing that also, why do you not look straight into an elder's eyes, and why do they not have eye contact as well too? And you might, the newer generations might be able to look you right in the eye and talk to you that way and have that eye contact going, but maybe with the elders, they're not like that. So understanding those beliefs is really important when you want to engage with them. And then also, how do you, who do you contact? And, Karrie went through the IHS areas, also went through the area boards, also, going through some of the other programs as well too. Just knowing those kind of things and asking those questions. And it's good to say, like, do you have your own board member, or do you have anybody that, if the government system itself too, like for the Navajo Nation, we have a president. And then if you go to the next tribe, they might have a chairman. And so does that terminology as well, and addressing them as, president, whatever it is, or chairman, whoever it is. Knowing all that makes the engagement and a little bit better for them, because then they think, oh, okay, so they know something about my tribe, or they know something about our community here. And so they'll be able to get that engagement going a lot faster, rather than trying to go in there and give them what you need to share with them. Get to know them first, research them if you want to, and as well as ask questions, because it's better that you ask them the question not knowing what it is. And if you don't know, say it too, because a lot of our tribal government, and also the tribal members themselves, like to know that you may not know something, but you're understanding, you want to be respectful. And if you put it that way for them, then they're able to also open up to you and be able to get you coming into their community as well too. So there's all sorts of things to look at, but I think the main thing is, if you're starting out and you want to understand a lot of the belief system, is knowing their language, how they live, what customs they have, and also some of their traditions within their community, knowing that, you know, sometimes they might have maybe a community ceremony that's happening within their area as well too, and not barging in and being invited to those kind of things as well too. So those are some of the things to understand. And this is, I know we're coming more from the basic side of it and not really getting into the nitty gritty, but these are something that will help you to be able to get that going as well too. And we're all here to help you out and to be able to, if you, after this presentation happens, you know, you're always welcome to ask us those questions afterwards too. And maybe you're not getting a response from a tribe as well too. And, you know, why would that be? So it's always good to have that conversation as well too. And I don't see anything in the chat right now. You guys are pretty quiet. But yeah, those are, thank you so much, Charlotte. Yes, a lot of those suggestions, advice, resources, anything that might help you, you know, that's something that I do on my end too, as an outreach and education person for National Indian Health Board. I'm the one that actually goes out to a lot of the tribal community on the NIHB side of it. So I do interact a lot with a lot of the tribes as well, and do that face to face. And that's one thing too with the tribe, is that a lot of times if they don't see you and you're constantly emailing them or you're calling them, it's good to have that in-person connection as well too, that engagement. And then it's also good to get to know other people within the community as well too, and they can also introduce you on their end. There are some tribes that you would rather have maybe another community member do the introduction for you as well too. So it's all about educating yourself, understanding those traditions and those beliefs for our tribes as well too. So, but I think we're going to go into our next session, right, Karrie? Or
Yes.
okay.
So now we're going to go into our next breakout. Courtney is going to put us in 3 breakouts, and you will have 10 minutes. I will post the questions in the chat box. And what we're going to do is just go back and just have some discussions on what Karrie and Kristen just talked about. What tribal Pacific beliefs should you consider when you're trying to work with tribes? And then also talk a little bit more about those approaches that you can take. We really want to make sure that when you leave here today, you feel comfortable starting the conversation. You may not know how far you gonna get up in there, but we want you to at least be able to pick up the phone or shoot a little email. I want to learn more. You know, do you have time to sit with me? Is there some opportunity for me to work with you? And let them know why you're reaching out, and then ask them, how can I help? What resources can I share that may be beneficial to you? So Courtney's going to put us in breakout groups now. You will have 10 minutes, and then we will come back to discuss. And then I will let you all be great for the rest of the day.
Okay, 1 second. So for some reason you didn't go to your breakout room. Let me see what's going on.
You're on mute, Tree.
Oh, all right. So we're back now. So I just have one more poll question for everyone today. And then I'm going to give my thank yous and then allow our speakers to close out. So I just need to know, how useful was this webinar today? Did you find the information beneficial? Did you feel like I need more, or it wasn't enough? Or, again, open, transparent, and honesty. Anonymous. We won't snitch. All right. So for the most part, we did well, team. So we do thank everyone for actively participating, engaging with us today. We thank you for joining us today. And I will allow our presenters and my program manager to say anything. And then I will allow Courtney to excuse us for the day. So Karrie, Kristen, do you have any closing comments?
No, just thank you. I learned something. I learned some things today, and I appreciate people sharing and allowing me to share with you as well. So thank you. But you're on mute.
There I go again. I have 2 mutes, so I always forget one of them. But anyways, I was just saying, I mimic everything that Karrie was saying. I'm glad that I was able to help and contribute and be able to give you maybe hopefully some helpful tips and being able to learn how to start that engagement with the tribal communities and tribal members as well too. And if you ever come up with a question, by all means, I am always available to answer those questions. So hopefully that this was extremely helpful for you. Thank you.
And a round of applause for our speakers and Courtney for managing the chat box and getting us into the rooms, and to all the participants. Yes. And now, Courtney, you have the floor to excuse us.
Oh, just a reminder to please complete the evaluation once Dree sends out the link, and give us a few days for the recording and the slides to be available on our YouTube channel and website. Thank you.